if I can ask our panel members to pop on their cameras, and we can do full introductions so you know who is joining us. So I will start. So my name is Kate Field. I'm the Global Head of Health, Safety and Wellbeing at BSI. My role is not internally focused, looking after BSI's internal health, safety and wellbeing, although I support our teams that do that. My role is externally focused, bringing my subject matter expertise to help and understand how we can provide the best solutions to help your organisation with your health, safety and wellbeing strategies. So if I'm going to go as they appear on the screen. So Peter, can I ask you to introduce yourself, please?
Yes, Peter Kelly. I'm the Senior Psychologist at the Health and Safety Executive. I'm also a member of the committee that was advising 45,003 and an expert advisor on mental health and well-being and also work-related stress. So this is an exciting time. Lots of hours and days of work, which Sally will tell you all about, has got us to this place. We have a great opportunity here, and if ever a standard was needed, such as this, it's coming out of COVID-19.
Lovely. Thank you, Peter.
We stay into it. Thank you.
Thank you, Peter. Ivan?
Thanks first to BSI, Kate and Sally, and the support team that have coordinated this really timely event. I'm Ivan Williams, Policy and Development Manager at the Institution of Occupational Safety and Health. My position liaises with the Policy and Regulatory Unit to strengthen IOSH's global advocacy work on a broad range of areas, not only health and safety and well-being, but also sustainability, decent work, or corporate social responsibility, in order to maximize IOSH impact and influence on global policy and practice. On this particular topic, we also advocate for health and safety and well-being to be embedded in policy developments in the field of human capital, business and human rights, corporate governance, and more recently into a sustainable reporting framework. As Peter was saying, I've also been the IOSH representative in the ISO 45003 working group. And well, in the past I worked for research, and I also did a PhD on regulatory approaches to work-related psychosocial risks.
Lovely. Thank you, Ivan. And last but certainly not least, Sally.
Thank you, Kate. I'm Sally Swindwood. I'm a Lead Standards Development Manager for BSI with primary responsibility for quality and occupational health and safety management. So my job is to liaise with experts, build relationships with experts, and help them to develop the standards that users indicate to us are needed to help solve problems. I also run the ISO Technical Committee responsible for the occupational health and safety management standards, and have been very closely involved, as Peter and Ivan can attest, in the drafting of ISO 45003.
Lovely, thank you. And if I can ask you to keep your cameras on but muted for the next discussion session, that will be lovely. So what we're going to do is actually just have a general conversation around what we mean by psychological health, and then we'll move on to explore some of the COVID-specific issues that I think we're all becoming very aware on before exploring the new international standard ISO 45003. So Peter, you get the pleasure of kicking us off, and I will be strict on timing though. So looking at the question, so I think it'd be really helpful for our audience if you can explain what we mean by psychological health, and particularly what relationship it has with mental health and stress and burnout. Please, Peter.
That's going to be easy. Okay, so let's start off right from the outset. Psychological health isn't the absence of mental ill health. It's actually a selection of other things that are there. Certainly, if people's psychological health isn't catered for at work, then the potential for mental ill health in work is going to be there. But essentially what we're looking at are those characteristics, and because this is obviously within the context of work, of the things that you do within work that can promote the health of your people. Now, for many, many years, we've put in the correct chairs, we've put the right monitors in for people. We've concentrated on the physical infrastructure of the office, the workplace, the factory. And what we've not really attempted to do is to look at the psychological elements of work, or what we would call as psychologists a psychological contract that we have, the expectation that the employer will look after your mental health. So in that context, mental health or psychological health are those things that you do in work that improve and sustain your work, your employees in a way that actually allows them to go home feeling the same, if not better, than when they arrived. It also, where it goes wrong is when we get to the position where we, as we all see from our own stats over here in the UK, 17.8 million days lost to work-related stress, depression and anxiety. That was before the pandemic, so it's 1 week into the pandemic. Our new stats are coming out in October. I'm not even prepared to hazard a guess what they're going to look like. But the point is, we have got a problem. We have a problem in the UK and we have a global problem, which is why a global standard on managing psychological health and safety and well-being at work is important. The outcome of poorly managed psychological health in work will be work-related stress, depression or anxiety made worse by work. Was
Lovely.
That quick enough, Kate?
That was very good, Peter. I was almost ready to jump in when you started to talk about 45,003 because we're going to get that, but that was perfect. Thank you for kicking us off, Peter. Sally,
contextualizing it.
Thank you. Sally, I'm going to come to you next. So where does this concept well-being fit in?
Oh, well-being. I think well-being is something that's often put to one side. Historically, it's been seen as a nice to have rather than an essential part of occupational health and safety. However, everything is pointing to the fact that well-being is foundational for occupational health and safety. So if we are not looking after people's well-being, other things go wrong. And that's why this standard explicitly mentions it and works on promoting well-being in the workplace. Whereas in ISO 45001, the standard that 45003 supports, it was explicitly not covered. Still considered at that time of writing too contentious, too difficult, perhaps. But the time has come where we can't ignore it anymore. We have to deal with this. So 45003 very explicitly does.
Lovely. Thank you, Sally. And Ivan, Peter gave us an indication of the scale of psychological ill health in the UK, but perhaps you could expand on that and give us some context around why psychological health is such a big issue, and perhaps its impact on things like productivity.
I think it is true that we are now becoming more knowledgeable on how the impacts of mental illness and ill health in the workplace can contribute to reduced performance, absence, higher turnover, or a reduction in efficiency within companies. And I think irrespectively of COVID, as Peter was introducing, I'm also conscious that for many years the focus has been on work-related stress, or even more recently on depression, anxiety, and mental ill health. But I think one thing that we sort of managed to agree within the working group is that these tend to be proper outcomes. So I think, and Peter would probably correct me if I'm wrong, but I'm one of many advocates that we trying to shift this mental health, the approach for mental health disorders to work-related contributing factors. And I think this is the whole thing about the guidelines when we're talking about work-related psychosocial risk. So we're talking about basically the work design, the organization, and social factors that could be happening not only from the internal context, but as we are now seeing, unfortunately, also from the external context due to the COVID pandemic.
Great, thank you, Ivan. And Sally, coming to you, and Ivan's touched on this a little bit, but is this a subject that's approached very differently in different parts of the world?
Yes, and I think that's why it is and it isn't. I think Peter's absolutely right. It is and it isn't. But the language that people use can be very different. There is stigma to some words in some parts of the world. There is a very specific meaning attached to some words in some parts of the world. But I think ultimately we as a working group of representatives from, I think, 35, 40 countries, we agreed overall on the approach. We agreed overall on the root causes. It was often the terminology and the methodology of dealing with it that took the long discussions. But there was a lot of consensus on what we shouldn't be doing. It was how we should go about doing it that caused a lot of the discussion.
Lovely. Thank you, Sally. So moving on, and Peter, I'm going to start with you for this next question, which you'll hopefully move on along in our slides shortly. Most of us aren't psychologists or mental health experts. So from a general supporting psychological health, what should we look for and how can we help as individuals?
Well, we have to essentially create workplaces that are the same as what a perfect environment may necessarily be at home. And what I'm trying to say is actually, if you're looking at people's mental health, if you know you have a workplace that's going to make people ill because we lead to work-related stress, mental ill health, you're not going to be a successful organisation. We know this from the Times 500 companies to work for. The top 100 all have health well-being programs in place, and they're big companies and they're SMEs. So the excuse that we can't do it because we're too small or too big doesn't really apply. But you need to be looking at what are the things actually that make the workplace a positive place to be, and what are the things that make the workplace a negative place to be. You're going into work and you feel out of control, and you feel out of control all the time, then there will be an association on your mental ill health. You will begin to feel symptoms of stress. If that only happens for a day, that's fine. Maybe if that happens over a series of days, then it starts to impact on your sleep and on your relationships with your colleagues and your family, then you've got a problem. They'll switch it around. If you create a working environment where people feel under control, where they feel actually that their health is as important as the outcome of what they're trying to achieve. And I think it's it's a very simple analogy. Look after your people's health, they'll look after you. Look after their psychological health, they will look after you as a company. So we should look for the things that actually promote and encourage people, and try to reduce and avoid those things that cause people distress. So, for example, in the HSE and our own management standards, demand, control, role, relationship, support and change are 6 characteristics of work. High demands, low control and low support have been associated with most cases of work-related stress, which will lead to potentially people going off with depression or anxiety. The alternative is control the demands, put in the ability to feel they can control their work and what they're doing in the work, and support them, and you might find it goes in a whole different direction.
Lovely, thank you, Peter. And
that was quick for me.
Come back to you. I know it was. You're doing very well. And I may well come back to you about the HSE stress management standards later. So, Ivan, I'm going to come to you next. And through the pre-submitted questions, we've had quite a few come in about mental health first aiders and their role in helping and supporting organisations in terms of the management of psychological health. What's your view of mental health first aiders?
I think this is a really supportive initiative that helps to increase levels of training, education, and awareness of the particular issue. But again, and I'm sorry, but I need to reiterate again, I think it comes as part of a more holistic approach. I mean, respectively, we're talking about medium-sized organizations or bigger multinationals. So I believe that there's a need to have a proper focus on risk management practices through a proactive risk management approach to psychosocial risk. And then as part of this risk management approach, the system will identify there's a need to implement training and awareness activities like mental health first aid in training. And I think one thing that we were mentioning, Sally, before in terms of the terminology, we also need to be conscious that mental health first aid training has been something quite successful in the UK and also in Australia, but other countries aren't that knowledgeable with this methodology or with this type of training. So I think this is also that we need to be mindful of.
Lovely, thank you, Ivan. And before I come to Sally next to start to explore the impact of COVID, I saw Peter put his hand up. I think Peter might have a comment to make about mental health first aiders. Peter.
Yeah, let me be straight out front and open and honest. If you'd asked me 10 years ago, would I want 228,000 people around that trained in mental health, I would have said yes, and I still say yes. But we have to remember that mental health first aid is, and you can talk to the mental health first aid about this, it's about providing a support service to individuals. And as an organisation, if you have a mental health first aider, that doesn't negate the fact you have to do organisational changes to make the workplace, as we were saying before, psychological healthy. I think it's good to have people there who are trained. I think the issue that you have afterwards is you have people that train, but you don't have systems to forward them onto, then you've got a problem. Because you've given them hope and then you've taken it away. And then, so actually the role going forward about what we do once we've identified people who've got mental health through mental health first aid, and the other thing is your mental health first aiders need supporting if they're there. But it's what we would call, and we'll get around to this later, a tertiary intervention. It's at an individual level. And certainly as a regulator, what I'm looking for is how you manage psychological health as an organisation. To a degree, what also you're doing for your individuals, but I need to know you're doing not just on your individuals. Teaching people to cope that's a bit controversial, but there you go.
Thank you, Peter. So if we can move on, and Sally, I think we've had a huge number of questions come in about the impact of COVID-19 on psychological health and well-being. Could you perhaps give us an overview of what that impact has looked like and what we're seeing in terms of the adverse impacts on psychological health?
Well, that's a very wide question, frankly. And this kind of goes back a little bit to what Peter was just saying about mental health first aiders. It's all very well having somebody there to listen. If you're talking, that's great. We need to be listening to each other because people are anxious. They're anxious about catching the virus. They're anxious about losing their jobs. They're anxious about having to go back to their jobs if they haven't been at their jobs. So there's a lot of anxiety. We have had bereavement. We have had potential bereavement, long-term serious illness. And then also for a lot of people, we've had psychosocial risks around workload. Some people have had too little work and other people have had far too much. And it's all been urgent and it's all been critical and it's been relentless. So you are possibly leading to burnout when you're doing that. So the range of issues that people are suffering and trying to deal with is immense because, yes, there are systemic things we need to tackle, root causes in workplaces, but this is much more complex because it is societally wide and each of us are individuals with individual contexts as well as dealing with our work-related things, and they are all meshed together. So coming back to the point about mental health first aiders, fabulous if your organisation has set up a system where you can talk to somebody about it, but those things like workload have to be tackled. Working hours, always being connected because a lot of us are working from home. We've got laptops, we've got mobile phones, we've got instant messaging. We're being contacted 24 hours a day, 7 days a week because those boundaries have gone. And that's one of the biggest impacts for people who have been working from home. And then, of course, on the other side, people who haven't been able to work from home have been required to go to work throughout this, have a whole different set of anxieties to deal with.
Lovely, thank you. I'm going to come to to Ivan and then Peter. So Peter, I'm going to ask you about some of those anxieties, and particularly, again, we've had questions come in around the anxieties between different groups, those who work to home from those who haven't, those who have been furloughed, those who carried on working. So we'll address that shortly. Ivan, in terms of the actual workplace issues, one of the things that we've had most discussion on and most questions come in about is working from home, and Sally's touched on some of the challenges there. Could you give us an overview of what the challenges and opportunities are in terms of working from home? And we've had a very specific around, should we continue to work from home after COVID?
That's a really topical question, isn't it, and also quite timely. It is true that in epidemic contexts such as the current one, and as Sally was saying, external factors affecting the mental health and well-being of workers need to be taken into consideration from an organizational perspective. So Sally was mentioning things like uncertainty, fear of becoming infected, but when it comes to things more related to remote working arrangements, so workers could be experiencing a lower quality of life or work-life balance issues. Social isolation is something that, especially in those countries that weren't that used to flexible working arrangements, such as working from home, workers might be experiencing. And I think we also need to bear in mind the gender aspect. So I think it has been evidence that women have been more impacted, and also people from ethnic minorities have also had a knock-on effect on this. And from a policy perspective, I think we also need to be mindful of the current landscape. So we are now seeing in the media conversations of the right to possibilities for the right to disconnect to be developed through regulations. I think this has been also happening in some European countries as well. So I think having this kind of like regulatory support plus supportive measures from employers is something much needed.
Thank you, Ivan. And are there any sort of positive benefits in terms of working from home and flexible working?
I think absolutely, and there's been plenty of studies supporting the imperative case for this to happen. But I would like to focus just on those professions that are, let's say, lucky or privileged to be working from home, because there are also so many different professions that aren't able to cope to this kind of working arrangement. But it is also needed that companies, workplaces prioritize investments when it comes to mental health and well-being for these particular professions as well.
Lovely, thank you, Ivan. I'm going to come to Peter, and then Sally, I'll come to you to ask if there's any guidance that's available to help and support organisations in terms of COVID safe working, and we can meet your cat, which is always lovely. As you can all tell, so many of us, we're working from home, so we always have the challenge and the opportunity for a little bit of extra humanity. So Peter, we have had quite a number of questions around kind of return to work anxieties, and in particular kind of the tensions or the anxiety created between people who've had a different experience of COVID-19. So for instance, those who have furloughed versus those who have carried on working, those who have worked at home versus those that haven't. And also we're seeing particularly now some questions start to come in about concerns about those who have been vaccinated versus those who haven't. So perhaps you could provide some guidance and maybe some tips around how organisations can deal with those anxieties and tensions, please, Peter.
Well, first of all, they have to address that they're there and actually state that they're aware that actually, if, let's say, you've been furloughed, you're coming to the office for the first time, for the first couple of weeks, you're going to feel quite stressed out getting on a bus, onto the tube, standing in an office with say, one of your colleagues who doesn't social distance because they've perhaps worked all the way through the pandemic, they don't necessarily have the same level of fear and factor. So what you have to do is set the right environment in the workplace to allow people to talk about it, but also to say, this is impacting me, and I need to be, can you use a little bit of space, can we find ways of working which actually help? The idea of plan offices, I love Sally's wavering tail, it's just magical. The idea of us going back to an office in the next 2 years isn't going to be 30 to 40% full. It is the reality. We may not get back to open plan office again for the foreseeable future. We may not be, so they're contextualizing it. We used to always be told you couldn't work from home, and now you can work from home, interestingly enough. As of the 21st of March 2020, you were always begging to go home, and then suddenly you were home, and then now actually you're begging to go back to work. Not always, but sometimes it's like that. So I think there's been there's been a sea change in how we work and the way we work. And I think in some ways it's a bit mad, isn't it, that it took a pandemic to change the way we work, to actually focus on making the work a little bit more developed around what would be right for your psychological health and well-being. And actually, you can trust your workers. What? Revelation, they will actually work. If they're at home, they won't be in the garden sunbathing or mowing the lawn. Or maybe they will, because they'll do it during their lunchtime. But the point is, we began to trust. And let's be really crystal clear here. There are 3 parallel pandemics occurring at the moment. There is a pandemic of recession, there is a pandemic of influenza, and we have a substantial pandemic of mental ill health on the horizon. I was trying to illustrate it once. It's like the perfect storm, isn't it? That big massive wave where the boat goes up. And actually, the wave is what potentially is coming, and why it's really important to manage people's mental health is because we don't want to see this tidal wave of mental ill health coming through. And unfortunately, if you look at all the stats on for the healthcare workers, Kelsey, which was a paper into last year, May BMJ, said there was a 20% increase in mental health issues for healthcare workers globally. And so these are people that have worked through the pandemic. So yes, we have an emerging problem, but we also have the potential to mitigate and reduce that by doing the right things in work.
Lovely, thank you, Peter.
And Ivan wants to say something, or two things.
Well, okay, so I'm conscious of time, so and also you may have guessed that I'm having some connectivity issues, so I've had to turn all the cameras off, so I can't see. Because I'm conscious of time, I'm actually going to move us on and ask Sally if there is any additional guidance to help and support organisations with COVID-19 safe working.
Absolutely. The ISO Technical Committee has developed ISO PAS 45005, which provides generic guidance for any kind of organisation during the COVID-19 pandemic, and it applies to organisations that have operated throughout the pandemic, organisations that had to close down or partially close down or change the way they were working. And it also deals with the returning to a physical workplace as well as working from home. So it's very broad guidance. It is very generic. It's not designed for, say, laboratory work or hospitals, COVID wards in hospitals. But in general, there is good guidance in there for everyone. Anybody can use it, workers as well as managers, as well as business owners. And it's free to download from BSI's COVID-19 page.
Lovely, thank you, Sally. So I'm just keeping an eye on time. We haven't actually had too many new questions coming because I have been aiming to cover them from the pre-submitted ones. So actually in this session, in terms of looking forward, I'd like to move us on to talk specifically about ISO 45003. So Sally, I'm going to start with you. Could you give us a brief background to the development of the standard and who the standard is aimed at, what sort of organisations? Thank you.
Sure. So this is a standard we've wanted to develop for many years. It was put off until ISO 45001 was published so that it could work with it, not least because our understanding of how to tackle psychological health, psychosocial risks, has been growing all through this time, and how we fit that with a wider management system standard was quite important. It is part of your occupational health and safety management, full stop. Whether you do it or not, it should be there. And ISO 45001 touches on it, but it doesn't go into detail. So this standard is for anyone, really. It could be used by HR people. It could be used by line managers. It can be read by anybody in the organisation, and there will be tips and guidance in there that will help. Even if it's you as an individual pointing out, initiating a conversation with other people, other colleagues in your organisation, that this seems to be an issue that's affecting us. One of the big things in ISO 45003 is participation and consultation of workers, of involving everybody in decisions that affect them, in making sure people are listening to each other and not dismissing other people's concerns as silly or irrelevant or not important. Because if you're feeling it and it's making you anxious, it's an issue. Now, it may not be an organisational wide issue, but it's very, very rare for only one person to feel something. There's usually an underlying cause, work-related cause in this context, that is causing it. So the standard can be used by anyone. You don't have to be an expert. You don't have to be in an OHS role. If you are working with people in your organisation, and most of us are, then there is benefit to this standard.
Lovely, thank you, Sally. I'm going to come to Peter next. So we've used the term quite a few times now through this session, psychosocial risks, but I think a lot of our audience might not really know what psychosocial risks are. So Peter, could you summarise exactly what this strange sounding term covers, please?
It's about the psychological and social risk in the workplace. No, obviously, what it is really is about those working practices that we engage in that have the potential to make people ill mentally, to impact their mental health. So that it could be, and I would say, that the way you manage your workload, the demands, the control and support, all of those elements of the management, they're all psychosocial risks. They're not risks. They only be in a sense that they only become hazards when they're poorly managed. Okay, so if you have high demands and low control, people don't really function very well. So that's what we mean when we talk about those psychosocial risks. It's also about whether or not, if you're in a work relationship and you've got a particularly aggressive or passive aggressive sort of relationship where that impacts you, because it's about bullying, or whether or not the individual's engaging in behaviour which is undermining. So, and actually, we may not be aware. There have been times, I'm sure, in any of our career where we've seen people become isolated within a team. So that's also part of the process. So the psychosocial are those characteristics of where demands, control, role, relationship change on one level, and also about the relationships that we have, the systems and work, and whether or not they actively encourage you to be to be able to reach out and to talk to colleagues to get you through. The interesting thing is you could have really high demands and low control, but if you've got a supportive manager and supportive workplace, you mitigate some of the impact of the previous two elements that are there. There's a really good definition. There's a really good definition in the standard. But as you can gather, after 2 years of meetings, and this one, the definition of this particular term took us nearly a day and a half, did it not, Sally? So
great, thank you, Peter. And I know in the standard there are a list of tables that cover and break down and give examples of psychosocial risks. So there's a lot of guidance in there. Ivan, I'm going to come to you next. And we've had quite a few questions around, what competency, what do you need to know and understand to deliver 45003 within your organisation?
One interesting thing is that the management of psychosocial risk does not imply just an individual approach, as we've been mentioning, through rather occupational safety and health perspective or a human resources perspective. But it entails, or it really calls for like a more collaborative approach of a strategic nature. I mean, not only at a business level. And the whole framework basically sits under an occupational safety and health management system, ISO 45001, and I think we believe this is the right approach, also of course supported by leadership. The other thing I was going to mention is that, of course, and this is we're getting some skepticism, as you could imagine, and it is true that capability is an issue, as not all the companies have or tend to have the in-house capacity to successfully manage work-related psychosocial risks. So I think this is the whole thing of having some comprehensive guidelines that need to be supported by some other measures. To me, one of the biggest benefit of these guidelines is that it will increase or help to increase awareness on the subject. And I think you were pointing out, Peter and Sally were pointing out to how critical in this pandemic is information and awareness. So making the most of our bigger audience, I will really point our audience to access information that is already freely available from international bodies such as the ILO or the World Health Organization, and also the work that IOSH has been doing throughout the COVID pandemic, so you can access all of our different resources. I think this would be really helpful for those organizations that don't tend to have that capacity, or even they are able to externalize that kind of capacity.
Yeah, lovely. Thank you, Ivan. And I think, I'd just like to reinforce that point. There's a lot of guidance out there, and there's a misconception that you need to be a psychologist or some sort of mental health expert in order to implement this standard, and that's not absolutely, that's absolutely not the case. It's been designed to help everybody in all types of organisations by giving practical examples. Sally, I'm going to come to you. Sorry, I'm conscious of time, Ivan.
I was just a quick one to say about Ivan's petition, which is there is guidance, and what we've sought during this whole process was to simplify the language, and Sally will reaffirm that. Many a time in meetings I've said, remember who we're doing this for, and that's really important. One of the things is regulators across the globe are doing things in this area. We have our talking toolkits, which are around work-related stress. The Australian Compensation Authority has information. America, Canada, you name it. So there are things there, but this is really about the collective opinion of a group from across the globe. So, sorry, Sally.
What were you going to ask me, Kate? Oh, maybe we've
Lovely,
lost...
thank you, Sally. Yeah, I've got the misfortune that I can't see. So we've had quite a few questions come in pre-submitted, but also we're getting a few questions come through about the relationship between 45003 and 45001, and why they are separate, and whether they can be integrated or whether they need to be seen as separate standards. So perhaps you could give us a summary of that, please.
Sure. So 45003 has been written to support 45001. So if you're using 45001, 45003 basically provides guidance for one aspect of your health and safety management system. It is not separate, it should be integrated, it should be all part of the whole. However, one thing that is worth clarifying is if you have not implemented ISO 45001, that doesn't make 45003 redundant. You can still pick up this standard and use it. There is useful advice in there, whether you have a formal management system for health and safety in your organisation or not. Ideally, they should be used together. But If you're not ready yet for a full management system along the lines of ISO 45001 requirements, please still pick up 45003 because it can still help you.
Lovely, thank you, Sally. And I'm risking turning my camera on because we're coming towards the end of the session. So I'm going to start to tie in some of the new questions that we've had sort of come in and group them together. So I'm going to direct this first one to you, Peter. And it's a question I think we see quite a lot of, the difference between psychological ill health that is caused by work and those factors that might be occurring and having an impact out of work. How do organisations navigate those tensions, and does 45003 address that at all?
Its simplest answer is yes. It attempts to address that, and there are guides in there. And here's the thing, though. If I, as an inspector, go into a factory and there's the absence of a guarding on a machine, and the person says, well, I'm suffering from depression or anxiety because I'm going through a divorce, or I've just had a death in the family, I still expect them to have a guarding on the machine. Okay? So my point is, I think we often differentiate, well, what about what we bring from home? Everything that we do at home comes into work, and everything potentially that we do at work can be taken back to the home. So the impact is a circular one. And so what I would be saying to you is actually address the things in work that you are expected to address. If you know you have excessive demands, then you have foreseeable knowledge that you're forcing your workers to do too much. You need to address that. If you've got 20 people and 19 are ticking along quite nicely, but one isn't, you still need to do something to support that work. That's where we get into the individual responses to maybe adapting that person's work role for the period of time that you're aware they're going through a difficult time. So I would say that if we, it's an excuse, right? People say to me all the time, you've got people at home, and actually we need to remember that our role as employers is to look after our people, so they'll look after the business, they'll look after us, and it's quite a simple relationship, which means actually addressing personal issues if they come in. And most of the time you can look at a situation, you can address it by looking at both the systems and the processes that potentially are not working and how they're impacting on the individual, and give them support. Why do we stop showing compassion and empathy when we come into the workplace? When we show it at home?
Yeah, I think that's.
I'm nearly on a Hyde Park moment there.
It was a perfect moment actually to say it, and I'm going to stay with you actually, Peter, for this next question. But obviously, if you can keep it as brief as possible, please. I mentioned that I'd come to this question. We've had it come in specifically. What's the relationship of ISO 45003 with the HSE stress management standards?
The relationship is that the management standards, or the principles of the management standard, are embedded within 45003. When I say embedded, we're talking about we seek to tackle stress at primary, secondary, and tertiary level, and they are part of 45003. They sit under the hierarchy of control, a model which is the prime basis of the 45001. So the relationship is, as with the Canadian standards and the Australian standards, and as with the American Total Worker Health, there's a collection of different international approaches that have been been brought together so you can be doing this. So if you have a safety management system, then you should be having a psychological health management system as well, and this is what 45003 does. If you don't have 45001, you could use 45003 to give you a very clear steer and direction of the things that you're expected to do to keep people psychologically healthy at work, which includes regulatory risk assessments and manage the risk.
No. Yes. Lovely. Thank you, Peter. Ivan, I'd like to come to you, and again, just conscious of time, and then I'll come to Sally, maybe to summarise 45003 and give us an overview of when it's going to be available. But we've had quite a few questions come in around, is there going to be sector-specific guidance, laboratories or manufacturing or construction. Perhaps can you give an overview or your thoughts on that and what the plan is in terms of sector contribution for ISO 45003?
I think it's fair to say that the guidelines are more of a generic nature, irrespectively of sector. Of course, you do tend to have sectors that can be more impacted by the psychosocial risk, and we already know this, and there's evidence about these particular sectors. And even employers, they are also conscious about these particular issues. So having a generic approach, as I was saying, is that we're basically saying that companies or employers need to tackle physical risk, psychological risk or mental risk in the same way that managing traditional safety risk or physical risk. So basically, it's all about identifying, assessing, controlling the risk, and engaging or communicating with workers, and then implementing prevention and mitigation measures.
Lovely, thank you.
So, sorry, just one last thing, and these aren't measures that are supposed to be expensive. So companies, for example, as we were saying, could just focus on high impact areas such as return to work programs.
Okay, thank you, Ivan. So, Sally, we're coming towards the end, and as we expected, we've had far more questions than we can possibly hope to get through. As I mentioned at the beginning, you'll have an opportunity to re-listen to these webinars, and we will be doing an FAQ to try and address some of the ones we haven't covered. Sally, perhaps you could just summarise anything important that we've missed about ISO 45003 and give our audience an idea about when it's going to be available in terms of publication timelines.
Sure. Well, just on that point, we expect it to be published in June. It certainly shouldn't be later than July. The final draft international standard is available now through BSI, and the previous version, the previous iteration, the DIS, is also available through a lot of standards bodies still. Whether you get the DIS or the FDIS or the final standard, it's all useful information. The standard has developed since the ballot that closed in November, December time, but nothing in there was actually wrong. So if you have a copy of that and you want to start work now and don't want to wait until June, use the draft and then have a look at the published standard in the summer to see if there's anything extra you can gain from it. So that's the first thing. I just wanted to go back on that sector question. At the moment, there are no plans for sector-specific documents, but we did work very hard in 45003 to look as broadly as possible. So we had discussions, for example, about the fact that you cannot eliminate psychosocial risks from some occupations. It's, well, probably any occupation, but some more so than others. If you are an emergency responder, a police officer, a healthcare worker in an accident and an emergency ward, if you are in a war zone, you will not be able to eliminate stress. It's intrinsically stressful. But there are still things you can do. There are still ways of helping workers in those environments. So no sector-specific guidance, but hopefully 45003 does provide sufficiently broad examples that it can be used in any environment. Peter wants to add something.
Right, so we're
it's 1 minute. It's a voluntary standard. Kate, it's a voluntary standard.
Lovely.
I think that's really important. Voluntary. It's not legislation. It'd be very good to apply it, though.
I think that's absolutely right, and we've had a number of questions around certification. Certification isn't mandatory. These are guidance documents, that have been brought together by international experts to help you and your organisations implement practical guidelines. I've had another question that actually I'd like Peter, as you're probably unmuted, to answer. And bearing in mind we are at the top of the hour, who should lead on the implementation of 45003? Is it health and safety? Is it HR? Is it somebody else? And where does leadership sit in? 60 seconds.
Okay, 60 seconds. Leadership is absolutely essential at the top. If they need to be leading to say actually people's health, psychological health and well-being is important. It sits in HR, it sits in health and safety, it sits with the line manager, and it sits with the company director. everyone has responsibility for psychological health and well-being. Thank you. 45 seconds.
That was very good. If we can just move the slides on, we are at the top of the hour. We do have a considerable amount of additional support available. There's additional support on 45,001, including the practical guide, which you could download from the panel. We mentioned ISO PAS 45005, which is the safe working during COVID-19, and there are supporting guideline documents for 45,001. And if we move on to the final slide, we do have additional information available on our website. You can see the addresses there. If you have questions about the standard, please contact Sally. If you have questions about training or certification or any other BSI services, do feel free to contact me. So that brings us to the end of the session. I would like to say a very huge thank you to our panel, Peter, Ivan and Sally, for your contributions to today's session. For those of you that we didn't get an opportunity to answer all your questions, I'm really sorry. We've had a huge amount of interest and obviously it's a lot to cover in an hour, but we will aim to follow up with as many answers to those questions as possible. So thank you very much, everyone.
Thanks, Kate. Thanks, everyone. Bye-bye.
Thank you.
Thank you. See you on LinkedIn.